I'm Giri. I'm an interventional cardiologist at the University of Pennsylvania in Philadelphia. And we are here today with Vikas Aggarwal, joining me from Michigan, interventional cardiologist there, to discuss a novel therapy to treat chronic thromboembolic pulmonary hypertension called balloon pulmonary angioplasty. When it comes to folks who are suffering from chronic pulmonary embolism, they may develop chronic thromboembolic pulmonary hypertension. A few percent of them will develop that, and that's actually their blood pressures are high in their lungs. That's going to lead to clear morbidity and excess mortality. And then many more may actually be symptomatic, even though at baseline they don't have chronic thromboembolic pulmonary hypertension. And historically, we've got a drug for this that's been approved, Riociguat, so there's a medical option here, but it's not perfect, right?
That's right.
And then we obviously have our great colleagues in surgery who can perform pulmonary thromboendarterectomy surgery, PTE surgery, but that doesn't work for everybody. Who doesn't that work for?
That's right. Surgery is not for everybody. It's a highly morbid, long open heart surgical procedure, and the surgeon can only take out the clots they can get to. And they can't get to the distal, more far out branches in the lungs. And those patients were pretty much being treated with the medication, as you said, so Riociguat, which helps them feel better. Balloon pulmonary angioplasty has now been shown to not only make them feel better, but it also helps them with the high blood pressure in their lungs. In a lot of ways, very similar to surgery. So those patients who are otherwise not candidates for surgery can now be treated with balloon pulmonary angioplasty in most circumstances. The other population that it really makes a difference is those who still have high pressures despite having surgery. Another patient population that's really important to understand and know is those who have chronic pulmonary embolism, are symptomatic, but don't have pulmonary hypertension just yet. Those patients don't have any medication option because Riociguat will only help you if you have pulmonary hypertension. And those patients are essentially everywhere. Chronic thromboembolic pulmonary hypertension is the worst phenotype of this disease, but that's just the tip of the iceberg. Chronic thromboembolic pulmonary disease without pulmonary hypertension is this huge patient population that's pretty much going untreated at this time.
There's a few different populations at play here. Certainly those patients who are not great candidates for surgery are clear candidates for this. Patients who have gone through surgery but still have problems, especially if it's more distal clot. Patients whose surgery is not technically feasible in the first place are candidates for this. And then the questions will remain on whether those groups expand.